Good morning, everyone. Welcome back to Kalkstein Chiropractic. It's Dr. Ward speaking with Daniel. And good morning, Daniel.
Good morning.
How are we doing today?
I'm excellent. How are you?
Your son's coming back for a whole month.
So I'm happy.
Yes, that's awesome. I'm excited for you. Your son's in
Dominican Republic.
Yep. So that's good news. And other good news is that your knee is feeling much better. So Daniel's a great case where we've kind of worked with him over the last 8 months in different areas that he's been wanting to work on from a health standpoint. So originally you came in with upper back and neck pain, pain traveling into the shoulder, and about 2 months, a month and a half to 2 months. Correct. And over a period of about 10 visits. And so that was the first thing that Daniel came in to see us for. And then when I got to start working on Daniel, he said, I'm feeling really good here, but I've had a long history of knee pain. And tell us a little bit originally how that knee pain started.
So it was 2 injuries to the knee. The first one was as a result of trauma, femur, which eventually a tip of the bone dislodged.
So what he means by when the bone dies or there's necrosis in the tissue, so bone is a live substance. There's cells in the bone. So when a tissue becomes necrotic, it's a cellular death, basically is what he's saying. So with bone, that's pretty serious trauma to have necrosis in the bone, especially from trauma, right? Usually those systems that create necrosis are going to be a little bit more of a metabolic attack, like an infection, right? So he had serious trauma to the left knee, where you had a piece of that bone, and it wasn't a large amount of necrosis, but enough where a piece dislodged into the kneecap itself. Correct. When you have tissues that are dislodged at a kneecap and you're moving around, they can lock up on you. The joints can lock up, and it's a pretty intense pain that people can experience. Usually it's the case with a meniscus, a flap tear, where the meniscus gets entrapped within the knee joint, and then everything just says, whoa, nope, stops moving, and it's pretty painful. So,
and it could happen at any time.
Yeah, it's like we were describing it like someone's just going to pop out and scare you at any time, and you just don't know when. Pretty much that with the knee, but with pain. So so that was going on for you. You had surgery to remove that piece of bone, correct? Yep. So arthroscopic surgery on the left knee, and then any other history of trauma to that knee?
So in addition, as a result of running, I was coaching youth rugby at the time. Okay. I was trying to chase down a player as part of a scrimmage, and I partially tore my ACL.
Yeah. So added to the problem list with the partial tear of the ACL, and they didn't perform surgery on the ACL. No. Nope. In most cases, unless there's an immediate need for the knee to be used in a sport, they won't do surgery depending on the age, depending on the job or the athlete. Right? It all very dependent on circumstances when it comes to partial tears with the knee. So I looked at your knee. Stability was great. You had pain around the patella. You had pain with increased pain with running, especially. So you're a runner, and you wanted to get back to running, and you'd had this history of knee pain, and you hadn't been addressed significantly up until that point. Did you do PT or did you do anything after the surgery?
Not really. Mm-hmm. No. The doctor told me I could start running, and I did, and I could run, but immediately after, when I'd finish running, the pain would start, the swelling would increase, and it just made it very difficult for the next day or two. Yeah. So I really like Daniel's case a lot because we got on top of this discomfort and this knee pain, right? He's had a lot of history of this trauma, and he's had a lot of pain with running. Now we changed up his workout routine, so we talked about the importance of combining strength training with running to alleviate some of that pain, to get his hips stronger. We talked about in the beginning about shortening up his distance, increasing his speed. A lot of times that can clear up deficiencies in the gait and take less stress off the knee. So we did a couple things in that regard, and that really helped you out pretty quickly with dry needling, soft tissue work. Adjusted him. He's been able to run pretty regularly now because of that. Yeah, immediately after when I started changing my running patterns in terms of the distance and the speed, that really improved things very quickly. Good. So instead of getting home and being hardly able to walk, things were normal. I would ice it right away. Right. I would elevate it, and it really worked.
So you went from your knee swelling up after every run to being able to just ice it and feel good.
Correct.
Right? And so huge difference in terms of the management, and I really think dry needling played a big part, as well as management from an education standpoint. He understood his importance of strength training, and he started doing that at home regularly, and his warm-up was active, and his pace was picked up when he went to run. So I think that in a lot of cases we as practitioners get scared of this running thing, and especially with a history of knee pain like that, where it's we say, maybe running's not right for you, right? No, there's ways around it, and there's ways of improving what we already got, and working in that realm first is the best approach, as opposed to show you how I do some work on the calf as well, and how I palpate, do an exam on the calf, and treat it accordingly. Okay. So we'll go ahead and get started.
How's it going in there, boys?
Come together.
Bring your heel back like this, and bring your toes all the way to your shin for me. Does that increase any pain in the calf, or just a stretch?
No, just a stretch.
Is the majority of your pain on the medial or the outside here?
So it was right here in the middle.
And did it lock up on you while you were running?
It was right after I was running, and I just suddenly felt it tight, so I stopped right away.
Okay.
And I just walked the rest of the way home.
We get my soap.
Right there. Right there. And again, that was the spot. It's not hurting right now,
Okay.
but that was the spot.
So just a little fascial tension in his calf muscle here, and his soleus. It's a little bit more superficial as opposed to deep to the gastroc. And trigger points. So he changed up his gait. He read an article that said, do this during your run, it can help. And during that change of the gait, it aggravated his calf. Most likely just where his contact was hitting, right in there. His contact was hitting on the ground. So I'm going to show you how we do soft tissue work on this later, and I'm going to dry needle his knee, okay? And that travels down into this area just a little bit. So you just have some, I would say, just fascial adhesions in this tissue.
Okay.
No true trigger point in here per se, but just tension within this tissue all the way down through the calf. So we'll work on that. We're doing some ART in a little bit, okay?
All right.
So now with the knee, we do a quad setup, and we do basically a paracapsule setup with him. And I'll come into tibialis anterior as well to do a needle point on that area too. So common fibular nerve comes down around this area, and needling the trigger point in the tibialis anterior can help with knee pain. And then I'll come into the quad group as well. Does your son have any wishes that he wants to do when he comes back into town?
I know he wants to, since his wife hasn't been here that
Yeah.
much. She's originally from the Dominican Republic. She'd like to explore. Go
Explore.
down to D.C., go
Yeah.
to New York, Philadelphia, explore the East Coast.
I love Baltimore for that, honestly. Yeah, we're smack dab in the middle of a lot of great things.
Absolutely.
DC is a 45-minute drive. Western Maryland is a really beautiful area, like
Yep.
Deep Creek Lake
Yep.
is 3 hours. Ocean City and the ocean is 3 hours east. And then you've got Philadelphia, New York City. You can even make it up to Boston relatively easily.
Yep.
There's just a lot to do around here. And BWI is an airport that's really accessible and flies international.
Yep.
Baltimore's got it going on. So had you been to a chiropractor before coming in to see us?
No, I came here on the referral from my wife.
From your wife? Was she
Yes.
a patient?
Yes.
And what were your expectations coming into the office?
When I came in, the shoulder injury was, the shoulder pain was significant. As in, I was having trouble sleeping, it was painful throughout the day. Ibuprofen, anti-inflammatories weren't touching the pain. So the relief was very quick once they started coming. So I just wanted to get rid of the pain.
I hear you. So in terms of your experience, you coming into an office like this, you were looking for a conservative approach to managing your pain, correct? You were looking for a route that was, say, just a little bit more holistic, if you will. Would that be true?
No, that's absolutely true.
Okay.
And that's something we've discussed as a family in terms of taking our approach to our health.
In general?
Yes.
Did you see me in the background, Leah?
See, I think that that mindset from a family perspective really does change. For us, that was definitely the case as well. So although I'm a chiropractor here, we've always kind of lived that lifestyle growing up. So it's not necessarily that I've been perfect growing up, because when I was a kid I was a terrible eater, but it's always been there, and it's always been an influence, and it's really changed us throughout that process. So it's been pretty cool. So when I do approach things too, from my standpoint, although I'm in this profession, I know that even if I wasn't, just being around the mindset of my parents the way they are, it would drive me to make the decisions accordingly. Right? It's just kind of that waterfall effect. Like I don't go and reach for ibuprofen or Advil when I'm hurting, right? I go and stretch or move or exercise or make sure I'm eating well or get adjusted, those type of things.
That usually takes a lot for me to
take something like that.
To even just take ibuprofen.
Yeah.
So when I did take ibuprofen and that didn't touch the pain at all. Yes.
Oh yeah, completely. And to be honest with you, if I was fighting something that was inhibiting me from doing my daily activities, and I wasn't getting relief from a conservative management just because I have it so easily accessible to myself, yeah, I would fall into that same pattern as well, just to try to take something to get me the relief that I needed. A little tension here. Good. So. From the quad standpoint, again, we've got 4 groups of muscles coming down to create this patellar tendon, and usually, especially with runners, I work on the lateral quad a little bit more heavily, and just from a palpation standpoint, some trigger points in the vastus lateralis is a quad group that comes through here, and vastus medialis. So you've got vastus intermedius. So you've got 2 quad groups where I'm focusing mostly on, and then I come down into the patellar tendon and into the attachment of the patellar tendon here as well. And then I'm going to show you where I dry needle the tibialis anterior, and then
like you're trying to touch the wall that's all the way in front of you with your hand. Good, but don't. That was better, but now pay attention to that leg that kind of is traveling up towards the ceiling. I want that going straight back to the wall behind you too. Good, so.
Sorry for the slow morning, everybody. I was halfway through my first cup of coffee, so I probably sounded very lethargic, but now I'm with it. Now I'm ready. I just had my daily dose of Tom this morning, and Daniel, I'm going to have you scoot over to your left a little bit. And I'm going to put your head right here under this pillow. Good. Yep. So I can clear your knee off the side here. Okay. So with soft tissue work on the knee, I will sometimes follow up a dry needling session. I find that I'm a little bit more effective in managing some of these tighter areas, especially when we go so long between visits, with a little soft tissue work after I dry needle on a spot. So I'm going to show you how I do a quad, and then I'm going to go over and work on his calf, his soleus muscle in the back here. Okay. And that area I want to spend a little bit more time on, just because of the depth of the length of the adhesions that I was feeling, and getting better movement there, so it doesn't become a chronic problem with him. So just nice and easy light passes in the beginning, and I'm doing all the work for him. I'm getting his tissues to loosen up, really getting his leg to let go a little bit more, to have him relax. And about 4 or 5 passes in, now I'll start to take depth and work the tissue a little bit more firmly. So when I do passive range of motion, I'll use my body, I'll reinforce with my hands, and if you can see from the other angle, I'm using my leg to guide his knee into deeper flexion. So So the quad group of muscles extends the knee, and what I'm doing is doing passes to increase flexion and knee group. Now, here, relax. I'm going to show you a little bit more of an in-depth look at how I do knee flexion with this. So there's certain quad groups here, there's muscles here that travel from knee to hip, but when it comes to knee extension, let's see, sartorius and rectus femoris, I hope I'm right on that, I believe I am, travel the length of two joints, so they go not from the inferior portion of the anterior iliac crest, but it's on the superior portion, so the anterior superior iliac crest, ASI. ASIS, anterior superior iliac. I have to recheck that. Let's start that over, Liam. What do you say? What is the AS? Maybe it is a little early morning for me.
It's like a cup of coffee.
Posterior superior iliac crest, PSI. C. Blanking on that. Okay, we'll start over. All right. Welcome back, everybody. It's Dr. Ward. I'm going to show you some ART or soft tissue work on the quad group here. He had dry needling in this area, and so with people that I find have a little tension and are a little bit longer between visits, I'll follow up with some soft tissue work like ART to increase mobility in these tissues. I've already done about 4 or 5 passes, so I'm going to get a little bit more in depth into my contact here and take the tissues through a little bit more of their end range when it comes to length. So as best you can, bring your heel up to the ceiling for me. Good. Increase the flexion actively as best you can. Now go ahead and extend for me. Good. And I'm going to start to reinforce with both hands. Go ahead again. Flex up, 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 up. Good. Back down. I love this massage table because it allows me to just get my body behind this as opposed to having to bend down with my back. I can really put force behind this pressure and get a better end range on the tissue. Let me know if my pressure is too strong, okay? And back up. Last pass here, go ahead. Good. And then I'm going to give you a little assistance to finish that pass out. Good. Now relax. Let your feet relax on the table, hips loose. So I'm going to adjust his midfoot here. Good. Let this bend up. Relax. Good. Now let the whole hip go. Nice and easy. There it is. Good. Alright, so I'm going to have you roll over onto your stomach. You can put that pillow right underneath your chest. So now I'm going to work on that soleus that it was palpating before we did the dry needling, and we can kind of follow up that path where he has that tension straight midline of the calf. I'm going to have him bring his toes, and David, go ahead and bring your body down about 3 inches towards me. That's perfect. Point your toes towards me. Good, just your toes. Good, and now I want you to bring your toes towards your shin. Good, back again. Good, and now go ahead. Good, extend. Perfect. And bring it back up. Good. Now push down on the gas pedal for me. I want to block him here. I'm going to basically do some PNF on the calf while he's laying here. So I have him engage this calf muscle for 5 seconds at about 30% effort. And then I have him relax completely. As he relaxes, there's just a way better end range to the tissue, and I can really get in there and separate some of those fibers and work on breaking up any adhesions. So again, come back and all the way down. Good. When you're working on this area, it's important to be patient because this tendon is so strong that it can throw your pressure off. So patience, firmness, and just waiting for the body to relax underneath your touch is important. And this is the area where you get a lot of your discomfort.
That's right.
Right there.
Yep. Now go ahead and flex again for me. I'm gonna stay on that spot. I'm gonna work it back and forth. So toes back up and flex towards your shin. Go, go, go. Good. I'm gonna give you a little assistance here. Good. Now press forward. Good. And again, right there. Good. He's gonna go for a run today to see how this feels afterwards. Any problems, you just come in later this week, okay? In terms of this calf or any cramping up, okay?
Good, thanks.
But this is really good. It's starting to move really well underneath my thumb, and I'm going to start to work into this myofascial junction that is where the two heads of the gastroc sit. I'm going to work that junction right between them here and get a little bit more separation of that tissue. Good. Okay, flex and roll right forward. Good. Okay, let the whole leg relax. Good. Perfect. So when I adjust his knee, I'm going to have him a little bit lower so I can get a little bit more over top of the knee. I palpate for medial and lateral instability or laxity within the joint. So when the tibia and the femur aren't lined up well in those condyles, you'll feel a little bit of joint play one way or the other. And so when I'm looking for, is I'm looking to find out which way he's unstable towards. So he had a little bit of a lateral setup on this side. I'm going to come to the base of the femur here, and so there's this tibial plateau that sits. My thumb goes right to the superior portion of that tibia, right on the lateral portion of that the tibial plateau. My pressure is firm, and this is the strut adjust videos. Good. And you keep this nice and relaxed. It's a firm pressure. Good. Good. So my contact is whipping into the tibia, and it really does a good job of releasing a lot of pressure just like that. Awesome. So go ahead and come on up for me, and we'll show you in the adjustment room how to adjust his low back and his mid back.
Oh, I know. I know.
So when it comes to adjusting the thoracic spine, and as I palpate down the spine, I want to find areas of tension within the ribs as well as within the thoracic spine itself. So the ribs coming in to attach to the back, about an inch and a half out to the sides, where I can palpate the rib heads and feel for spasms. And when I get into a spasm like that, the patient will be able to feel a sense of tension. So nice and easy. Let this left shoulder drop here. Good. 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 Take a breath in for me. Easy exhale. Let it go. Good. Let your shoulders drop. Perfect. So a little rotation in the ilium, a little bit of a restriction in this right SI joint. Right when I get my hands down to this area, I can just palpate and feel that buildup of muscle through the low back, as well as a little bit of rotation in the pelvis. And so when I adjust him, I'll adjust him accordingly for that. And then a little restriction in the sacrum on the left side, so I'll make sure I'll focus my adjustment a little bit lower here. So do me a favor, down and go onto your right side for me and face me. So I want you to bring this leg all the way up and let's let it drop for me, okay? Good. Take a breath in for me. And exhale easy, let your shoulders relax. Good, loose here. Beautiful. Come on your other side for me. And when I get an adjustment where the pressure is light, and you almost have a good clean movement to the feel of the adjustment, the patients, one, will have a really good experience during that moment. They'll feel like, oh, that felt really good, right? And I really think that's just aligning the tissues up correctly, applying the right amount of force, and skill, knowing where to really focus the body's position to make that move better, right? So if I set him up in a different way on that opposite side, it wouldn't move as cleanly as it did, right? Take a breath in for me here. Easy exhale. Shoulders are loose. Good. So a little bit more extension into my hand here. I'm getting his back into his extension. Good. Come on your back for me. Nice and easy. And I'm going to adjust his hip on this side a little bit more. Let this go. Just a little stiffness in this hip. Let it drop. There we go. Good. All right, so you heard his story, which is pretty cool to see him go from a shoulder neck complaint to a chronic knee pain getting resolved with dry needling, changing the gait, changing the fitness routine, going through some strength programs here, learning that and applying it before your race. And then you saw me how I worked on it today, where I dry needled his left quad. I did soft tissue and ART on his quad as well as on his right soleus. And then full spine adjustment, a thoracic and low back adjustment, hip adjustment, and a knee adjustment. So thanks for letting us shoot today. I appreciate it.
My pleasure.
It's always good to see you.
Always good to see you.
Thanks for watching, everybody.